Good evening, Doc. Good evening po sa lahat. Okay, continuation po sa tongue diagnosis may DC, dry and white or yellow coatings. Okay, independent of its color, a dry or rough-looking coating is always an indication of depleted body fluids. For example, a white, greasy, dry, or rough coating may suggest spleen and stomach chi deficiency, as well as deficiency of fluids in the stomach. On one hand, owing to the weakness of the spleen and stomach chi, there is an accumulation of dampness, giving the coating its greasy consistency. So kung nasusundan po natin, dahil po sa deficiency, nagkakaroon ng dampness, and yung nakikita natin is greasy coating. On the other hand, the deficiency fluid in the stomach means that the tongue is not receiving adequate moisture. So ang resulta, the coating will appear dry. If the coating is yellow and dry without being sticky or greasy, it is an indication of injury to the fluids by internal heat. So yellow and dry, tapos hindi siya sticky, without being sticky and greasy. So there is an internal heat, which will thicken any accumulated dampness or phlegm in the interior. As a result, the coating will become rough and dry and yellow in color, all of which suggest the presence of heat. Okay po? So we have here a picture ng case ng female, 28 years old. So yung tongue po niya, meron siyang pale, swollen, slight teeth marks. So meron po siyang teeth marks dito po sa side. Kung i-check po natin yung picture, this indicates that spleen chi deficiency, which is an accumulation of dampness. Next, there is dry white coating in the anterior third. So dito po sa may harap ng tongue and center of the tongue. Okay? So meaning there is an accumulation of cold phlegm naman. Yung greasy thick yellow coating in the posterior third, kung pagmamasdan po natin maigi, yung yellow coating sa likod ng tongue, meaning there is accumulation of damp heat in the lower burner naman. So ang symptoms ng patient, meron siyang nausea after eating cheese, runny nose or congested nose, meron siyang cough with copious amount of mucus, there is dizziness during menstruation, may backache, frequent urination at night. Sa Western diagnosis, meron siyang allergy to cow's milk, may allergic rhinitis. Sa background to disease, there is an excessive consumption of fruit, a minimum of 10 bananas per week. So yan po yung patient natin. So sa case history, for 6 months, the 28-year-old Mrs. H followed a new diet. In the morning, she ate only fruit, and her other meals consisted mainly of fresh salads and vegetables. As Mrs. H was hungry in between her main meals, she satisfied her appetite with bananas. She liked this new diet because she could not tolerate dairy products. However, while following the diet, she became increasingly tired and was more susceptible to cold. So ito pong diet niya, mas nagwi-weaken siya, mas madali siya mapagod, and madali siyang maapektuhan ng cold. She had contracted a cold several months before, which left her with a cough. She expectorated copious amount of white sputum. She also complained about constantly runny nose. Her sleep was troubled with a frequent urge to urinate. Her urine was yellow and odorless. Conventional medical tests were negative. The tongue showed a dry white coating in the center and anterior third, and a thick yellow coating in the posterior third. Her pulse was confined and submerged. Okay po? So sa analysis, this is a typical example of how raw food can injure the spleen chi. Cold food lessen the transformative and transportive strength of spleen chi and yang and contribute to the ensuing accumulation of dampness. So ito po yung one example ng pagkakain po ng mga raw food na nag-i-injure po ng ating spleen and which result to dampness. In this case, the spleen chi deficiency was discernible in the swollen tongue body with teeth marks. So, ito pong patient, mas madali po natin ma-check through tongue with the swollen tongue and with teeth marks. The white dry coating and firm pulse reflected accumulation of cold dampness and the ensuing stagnation of chi in the middle burner. So, white dry coating, tapos pag pinalpate yung pulse, meron siyang firm pulse dahil po sa cold. So, yung firm pulse dito is pag pinalpate natin ang pulse, malalim po siya, pero matigas. This is because yung na-discuss kanina, yung dahil sa cold, yung yang is unable to push the pulse upward. Kaya hindi mo siya mapapalpate superficial. So there is a deep pulse and firm or strong siya dahil po sa cold dampness. The dryness of the coating points to the long-standing accumulation of dampness. So dahil po sa dampness, nagkaroon ng dryness sa coating and the resulting constraint in the movement of chi. The regular consumption of bananas further contributed to the spleen chi deficiency and to build up dampness and phlegm. So kung meron ka na pong dampness dahil sa spleen chi deficiency, more consumption of bananas, so more din or nag-increase din ang dampness and phlegm. The symptoms also suggest that dampness is a causative factor for her complaint. The runny nose and the cough with copious phlegm reflect the impairment of the lung's downward moving action as a result of the retention of phlegm. So dito yung action ng lung, which is a downward moving action, na impair po because of the retention of phlegm. Because dampness is heavy and tends to sink, it transforms into damp heat in the lower burner. So yung dampness naapektuhan din yung lower burner. And it is responsible for the frequent urge to urinate in this case. Okay po? The thick yellow coating of at the root of the tongue reflects this pathology. So, yung po yung nakita natin na thick yellow coating and affecting the lower burner, also affecting the frequent urge to urinate. So, yung po yung damp heat. Okay, we have another case. This one is 31 years old, female. Yung tongue niya is pale red. Ibig sabihin, yung color is normal. There is presence of red raised points in the anterior third. Dito po sa tip ng tongue, which is the anterior third, ibig sabihin, there is heat toxin in the upper burner. Yung dry, rough, white coating naman, pag in-observe po natin mabuti, dito po yung covering sa may tongue. Ibig sabihin, there is deficiency of fluids in the stomach. Yung symptoms ng patient, there is swollen cervical and inguinal lymph nodes. There is also stomach pain and epigastric fullness. And there is distended lower abdomen. Sa Western diagnosis, this is a case of non-Hodgkin lymphoma. Ang background to disease, there is a condition followed by radiation therapy and chemotherapy. Okay po? So we have another case of a female 39 years old. Yung tongue niya is pale, swollen with teeth marks. So observe po natin yung sides ng tongue. There are presence of teeth marks and this one is swollen. So this indicates that there is spleen deficiency with accumulation of dampness. There is also a vertical crack with light yellow dry coating. So observe po natin yung picture. There is a vertical crack, tapos light yellow color, and dry po siya. Meaning, this indicates that there is accumulation of phlegm with slight heat developing in the young brightness, young main channel. Also, there is white dry greasy coating in the middle third. Sa gitna po. This indicates that there is insufficient production of fluid or there is spleen deficiency. Yung greasy thick yellow coating with red points in the posterior third. So sa likod po ng tongue, there is greasy thick yellow coating and red points, meaning there is retention of damp heat in the lower burner. Okay po? Yung slight depression at the root of the tongue, dito po sa likod ng tongue, may parang build-up ng depression or parang kanal. Ibig sabihin, there is slight essence deficiency. So, ang symptoms ng patient, there is loose teeth, there is bleeding gums, frequent periodontitis, there's strong smelling watery diarrhea, flatulence, there is sour taste in the mouth, and exhaustion. Sa Western diagnosis, there is periodontitis. Ang background to disease, there is irregular lifestyle during puberty with alcohol and drug abuse. Okay po? So, next patient, we have a female 32 years old. Ang tongue niya, there is pale slightly and slightly thin. So manipis po yung tongue in pale color. This indicates that there is slight deficiency of blood. Yung tip ng tongue, there is a red tip, meaning there is heat from deficiency in the heart. Yung vertical crack with light yellow dry coating, ito po sa gitna, there is a vertical crack with light yellow, yung coloration, and dry din, meaning there is accumulation of phlegm with slight stomach deficiency. Okay? Yung greasy dry pale yellow coating, meaning there is deficiency of fluid with internal heat. Ang symptoms ng patient, there is cough with copious mucus, there's black nasal passages, there is thirst, dry mouth, heartburn, and exhaustion. Sa Western diagnosis, there is chronic sinusitis. Ang background to disease, there is excessive consumption of dairy foods and caffeine abuse. So, mahilig siya sa coffee. Next, we have a female 38 years old. Ang tongue niya is reddish, big, rough tongue body. Okay? Check po natin yung picture. Meaning there is kidney deficiency with slight deficiency of fluid. Yung meron din siyang red points on the tip, meaning there is heat in the heart. Yung white dry coating turning yellow towards the center of the tongue. Okay, check po natin yung picture. There is yellow coloration, meaning there is accumulation of phlegm or heat developing. Ang symptoms ng patient, there is purulent stye, meaning itong stye, dito may inflamed dito sa may eyelid ng patient. May inflammation. Meron siyang red conjunctiva, strong thirst, may constipation, inability to sleep through the night. Meron siyang inner restlessness. Sa Western diagnosis, there is chronic sinusitis, there's acute conjunctivitis, and sa background to disease, this patient is overworked, kulang sa sleep, and long-standing emotional problems. Okay po? So, thank you po for your attention.